Hello guys, hope you're all doing great and you're all enjoying your life. I'm Dr. Arshad Nadeem Awan with my ultrasound and radiology teaching video. Today I'm going to discuss about one of the very important brain tumor, that is pituitary. I would rather say it's a pituitary tumor. So this is called as a pituitary adenoma. Pituitary adenoma is a slow growing tumor and it arises from the anterior pituitary, and it is of two types. It may be microadenoma or it may be macroadenoma. Microadenoma, if it happens to be less than 1 centimeter, and if it increase than 1 centimeter, it will be called or considered as macroadenoma. So for the symptoms are concerned, many a time it happens to be asymptomatic, and this would be an incidental finding. In few cases, it will give rise to hormonal abnormalities, like there will be prolactinoma, or there may be Cushing syndrome, or there may be gigantism or acromegaly. This would be related to the symptomatic patient. Or it may also cause mass effect, like there will be visual disturbance. So this may be the clinical presentations of the pituitary adenoma. So far, its radiological features are concerned. Microadenoma will always it will be in the sella turcica, and it will compress the pituitary fossa, or it will depress the pituitary fossa downward. And the another characteristic of the microadenoma would be this would be on the one side of the pituitary gland. So for the macroadenoma is concerned, it will balloon the pituitary fossa, and the second, it will elevate all the supra. I would say whatever is in front of, like the third ventricle would be elevated, and it will cause the compression on the foramen magnum, or it will also be having associated with the hydrocephalus. So these two features, how we will see on the images, on the ultrasound, on the CT images, on the MR images. And the another point should be noted, should be worth noting, that is, so for the microadenoma is concerned, microadenoma is quite often treated medically, and macroadenoma required surgery. So these are all the points. I will further narrate on that while I will be showing you the CT images and MR images. So let's start watching these images and find out how the microadenoma will look like and how the macroadenoma will appear on the radiology images. On this CT axial image, you can appreciate that there is a well-defined, slightly hyperdense round lesion arising from the sella turcica or pituitary fossa, and also causing upward compression of the sphenoid sinus. So this is what the pituitary adenoma is. And normally pituitary adenoma, if it is less than 1 centimeter, it would be microadenoma, and usually give rise to symptoms. But if it is more than 1 centimeter, so because of the mass effects and because of some hormonal problem, it will give rise to certain characteristic symptoms. So far this case is concerned, this happens to be a macroadenoma because the size of this lesion is greater than 1 centimeter. On these axial CT image, you can appreciate an enhancing lesion, and investigation of choice is MR, and you have to do a fat saturated T1 sequence after the administration of IV contrast. And here you can appreciate that this is a macroadenoma in large, more than 1 centimeter, and it will eventually give rise to some endocrine symptoms, or it because of the mass effect it will also give rise to some visual abnormality. So this is how the pituitary adenoma will look on the MR fat saturated post contrast sequences. Another example has been taken from the RADS wiki. This is MR image, and on MR image this particular slide shows macroadenoma, and this is pituitary adenoma. On the CT image in the sella turcica, a hyperdense lesion is seen in the area of the pituitary gland, and this is what the pituitary adenoma will appear on the CT imaging, and it is compressing the optic chiasma. On this axial CT image, you can appreciate a slightly hyperdense mass within the sella turcica, within the pituitary fossa, and it is macroadenoma. On the basis of the size, it will either consider as micro or maybe macro. If less than 1 centimeter, it would be micro, and if it is more than 1 centimeter, this will be macro. So this is what the macroadenoma is on the CT images. This is the axial CT image, and on this axial CT image, one of the characteristic diagnosis is lying, and that is pituitary apoplexy. Pituitary apoplexy is a condition when there is acute hemorrhage occurs, and it's lead to rapid expansion of the pituitary gland and resulting into the compression of the optic chiasma. This is usually seen in macroadenoma. So here you can see this is a pituitary apoplexy because there is acute hemorrhage within the pituitary gland. You can see that this white hemorrhage can be seen quite clearly. So this is how the pituitary apoplexy will look like, and it will cause compression of the optic chiasma. So this is what the CT axial non-contrast CT axial image, which is depicting the hemorrhage within the pituitary fossa. Another example for the better understanding, this is a CT image. Although CT is not a reliable method for the confirmation of the pituitary tumor, you have to have the MR scanning with the fat saturation, and post contrast images will help you to diagnose the pituitary adenoma. But in that case, in a primary level, you can still appreciate on the CT images. So this was the example of the pituitary adenoma. So multiple slides has been shown regarding pituitary adenoma, including the CT images and including the MR images. You have also noticed that macroadenoma, the appearance of the macroadenoma and how it will be appreciated on these radiological imaging. Beside this, another entity which is pituitary apoplexy, where the acute hemorrhage take or occur within the pituitary tumor. So that is already discussed with you guys. So hope this would be a very beneficial video for you. Keep watching this video, keep sharing with other colleagues, and with some new information we'll see each other. Till that, take great care of yourself, and thank you very much.